na nipa dodo a awo no me gisa me chirechire mu kakra ebi age ba ko ebi age mienu ebi age mensa o kan nyina abomu a doses dodo a yawo around 25 million opipi aduonum eni achire kakra
yeah, sure. When I the 7th campaign, what is new?
Oh, baby, I knew. Baby, I knew what I say. New said the entire year to us, crampon. Said somebody can bra if you see now. Your bomb who the room crack a chain. This our strategy. I say. She said, "The near polio no near you never see her." Now, you who say a year Juma. So share map now. Me show you a graph now. Me show you now. 10 be I bubble the rules. I know. One say costro. Nini na actually say, and yes, and go for person more. Let me say, adagye ni ade ni say, young family omono. Maybe a nuntia. 10 be a campaign. Be I won't say vaccination no costro sa. Now the entire year this time they say, and che be a busumi a chair. In fact, busumi no chair around May, early part of May now. WHO car say COVID. Aye yare fufura bay. Men kind of men put no longer a disease of public health concern. Meaning say, and as I say, said ye canino na ye restrict for men ko ha ye say near the no. Sabreno ye chum because COVID abeye yare ni yet. Inti say a choir ye befa so abon ho ban na choir befa so asia no. Yes, son. That's all it means. It doesn't mean say because all the two BB to say polio one. A can't be polio is still a disease of public health emergency of international concern. Polio. But I'm saying, yeah, I'm saying, Sabi polio unkunk of one and you can't say no longer of public health emergency of international concern. And no interest say, Yarianako. In Santina Sabri, I see a per se. Yeshimukina said ye betwe amanfo adwene asisu se yare na nko yo wo hwe amaye twa ho ahia ene amanone bebre. Some are getting a lot of cases ye nimbra abo no bedane ne ho how say COVID enye predictable sa to de bia na adane ne ho na akɔhye coach foforo na aba ɛdu nti na yesi ye hye banbo no mu kenya no isa nti ne ye sa ye beto asoso nye we nye se we nko a ye beto aso nti ka se dear Michire Muina and say Abuano on Koye, yes, is no longer of international concern. And Koye, inti Kofobe Bri misinterpreting and say Yarena Yasavi, and Koye, and Nuntina, Saumbo Hubaya, Saubo Hubay. Ages, okay, a free china, it is a feature copy Casiada. 2019 to 23rd. And only a year see one, and don't just hear we are nasa. Now, vaccine was here no. Okay, we share eligibility criteria. Vaccine na say bambo pania wo ho sisi ade omo manya mfie dun wotwe e de ko no. Me hu de enti a obisa ta no. Ai vaccine ye wo sisi no. E kirechire mu Johnson and Johnson no ye 18 years and above. Ye nya Pfizer e beba 15 bio. Enti nya 15 year eligible, but vaccine was here a day, sa campaign we did 18 years and above.
Campaign we did 18 years.
Yes, so let me explain again that for this particular campaign we are doing for this 5 days, you know, it is Johnson and Johnson.
I'll start with my own experience in vaccination. I think the first one was very nice. I had taken first dose was just mild symptoms. The second dose, I didn't feel anything at all. My booster, the second day, I had a lot of pain and body weakness, but I survived. All I'm just saying that it's not always going to be as nice as you say, but the most important thing is that it helps you to boost. So if you have some mild symptom, doesn't mean that it's a bad vaccine, but you should expect that in some stages you may have a different reaction, but it's all good because the body is now boosting itself to be able to protect you. Thank you all for being here today as we gather to mark another significant milestone in these COVID-19 vaccination efforts. As we are all very much aware, over the past few years, the world has faced unprecedented challenges in the healthcare delivery. The COVID-19 pandemic has tested our resilience, disrupted our lives, and claimed the lives of too many, not just in Ghana, but globally. COVID-19 brought the entire nations to standstill, strained healthcare system, disrupted our social norms and economies, and Ghana was not spared as the pandemic severely affected all facets of our lives. In the face of these hard times, we have shown remarkable unity, strength, and determination, and that is why we are here today. Dr. Chair, please allow me to add my voice to applauding our health staff, the media, the community volunteers, religious and traditional leaders, our Queen Mothers here, our health partners, and all stakeholders. You have been very remarkable in the fight against COVID-19. And we thank you all. Ladies and gentlemen, as has been said earlier, on the 1st of March 2020, we began a journey to vaccinate all eligible persons in Ghana against COVID-19. Our target since then has been to vaccinate over 20 million persons aged 15 years and above. We have employed diverse strategies, including periodic vaccination campaigns, as was ably presented by the program manager. We've had special vaccination exercises to hard-to-reach areas in the riverine areas, in all those suburban areas, in schools, among other places. These strategies have yielded positive results, leading to a lifting of many restrictions. As of yesterday, as was said, we have one active case. That seems small, but it is small because it's not you. If it is you, it's 100%, isn't it? Okay. Nearly 26 million doses of COVID-19 vaccine have reached almost 14 million persons, out of which 10 million persons are fully vaccinated. And as was said earlier, this represents about 59.4% of the target. While this is a commendable achievement, the country is still far from achieving its national target. This means that the whole population still stands at the risk of a likely event of new variants as COVID-19 remains extremely unpredictable. And I must say, as you saw the program manager present, this total dose represents about 34.46% of the population. What it means is that almost 70% or a little over 60% of the population are unvaccinated, isn't it? But the vaccine, COVID, even though we are not vaccinating children, COVID can affect children. So we still have a lot to go in, ensure that as many people are vaccinated as possible to increase our protection. The country continues to learn from recent new cases and active infections in many countries. As you have heard, including China, we have outbreaks in Philippines recently, Vietnam, the USA, Poland, and Brazil. With continuous new infection, the virus still has the capacity to spread through the population easily and rapidly. And I must add that our last COVID death was in January, and I don't think that is far away. That is not too long ago. And so we had a death in January this year. Dr. Chair, as you may recall, on the 5th of May 2023, WHO Director General, through the advice of the International Health Regulation Emergency Committee, determined that COVID-19 was now an established and ongoing health issue. And which no longer constitutes a public health emergency of national concern. It didn't say COVID was over. It is now established. The declaration does not mean, as I said, that the COVID-19 pandemic is over. What it means is that under the international health regulations, the management of COVID-19 is taking a different approach. That is integrating COVID-19 into existing health delivery mechanisms. The WHO therefore recommends that countries maintain efforts to increase COVID-19 vaccination coverage for all persons to maintain the gains made in our fight against the disease. I have been said earlier, currently over 4 million persons who qualify to receive the COVID-19 vaccine are yet to do so. And an additional 3 million are yet to get fully vaccinated. To protect the population more effectively, it is critical that all eligible persons receive the full dose of COVID-19 vaccine. In view of this, the Ghana Health Service and its partners are rolling out the 7th National COVID-19 Vaccination Days campaign from tomorrow, that's the 19th of July, to Sunday, 23rd July 2023, across the country. This campaign is an effort to intensify our COVID-19 vaccination across the country to bring us closer to our target as we prepare to integrate it into our routine immunization program. Dr. Chair, vaccination continues to be a critical tool that has not only protect us as individuals, but also safeguard our families, friends, and communities. It is an act of solidarity, an act that demonstrates our commitment to the greater good, and so all should make sure they participate and get vaccinated. Dr. Chair, allow me to emphasize and assure everyone that the COVID-19 vaccine have now reached millions of people worldwide and continue to be safe and effective in preventing severe illness, hospitalization, and death caused by the virus. And I'm still waiting for the person who take the vaccine and change from male to female or reverse. I'm sure they are still waiting, isn't it? Mr. Chair, from tomorrow, trained health workers will be available at all facilities and temporary health posts to administer the COVID-19 vaccine to all persons 18 years, 15 years and above. In addition, mobile teams will move to towns and communities where they may be located at schools, churches, mosques, bus stops, barriers, and market areas to vaccinate people. Let us remember that our fight against COVID-19 is not yet over. We must continue to follow our public health guidelines, practice good hygiene, and remain vigilant. And I think good hygiene has greater benefit than just COVID. And so it's something that we need to not just only practice, we will socially try and put some of these things in our building code. We must continue. The virus has shown its ability to change, form, and evolve, reminding us that we must stay one step away ahead of the virus. Today, as we march, we launched the 7th COVID-19 Vaccination Days campaign. Let us look forward with hope, resilience, and determination. Let us stand united in our commitment to protect one another and build a brighter future. I will continue to urge all district chief executives, our regional ministers, to continue their leadership roles in the districts and regional levels in this noble fight against COVID-19. I also call on all civil society organizations, community and religious leaders to continue to put all hands on deck to consolidate the gains made in the fight against the spread of COVID-19. And to our dear colleagues in the media, you continue to play a very important role in influencing the behavior change. You have been very supportive, and I urge you to continue using your platforms to encourage people to take the vaccine. Support the Ghana Health Service to educate the public and address misinformation and disinformation by verifying information on the vaccination process from the Ghana Health Service. Distinguished ladies and gentlemen, the significant gains made in controlling COVID-19 so far could not have been possible without our partners. And I wish therefore to thank all our partners, particularly WHO, UNICEF, the World Bank, the Global Fund, the European Union, USAID, JICA, that's Japanese, CDC of USA, PATH, GSK, UK Aid, Ghana Coalition of NGOs, Gavi Allowance, our community volunteers, traditional and rural and religious leaders, the media, and all who have contributed to bringing us this far in the journey. Dr. Chair, ladies and gentlemen, in conclusion, the success of this vaccination exercise requires our collective efforts. Until everyone is safe, no one is safe. It is now my singular honor and privilege to declare the 7th National COVID-19 Vaccination Day campaign duly launched. Thank you, and God bless you all.